My Doctor, your health anytime, anywhere. Hello, lovely viewers. My name is Mwesigwa Joy. Welcome to the My Doctor podcast, where our aim is to link the community to various doctors. So we're going to be having various doctors engaging in various topics, where we're going to make sure we improve our health as people. Yeah, you know, I contribute to my own health, you contribute to your child's health, everyone contributes to the health of the community. So for today, we have a topic, and the topic is child health, and we're specifically going to be talking about adolescent health. So I have a very beautiful guest here with me, a very beautiful doctor. She's a specialist in infectious diseases of children and adolescents, and she's also the founder president of Society of Adolescent Health in Uganda. She's a lecturer at Macquarie University. She's a very lovely doctor. So today we're going to be talking about child health and adolescent health. Hello, Dr. Sabrina.
Hi, Joy. I'm really excited to be here at the My Doctor podcast and looking forward to having a great conversation.
Thank you so much. So our topic today is adolescent health, and I understand that's something you're very intimate about. So could you please tell us some of the challenges that various adolescents are facing in Uganda? What are some of the things you've seen in our various adolescents?
Thank you. And perhaps before I even start, I'd like to say that we started a general adolescent clinic at Macquarie and Mulago Hospital, and also I ran a general adolescent clinic at the IMC CK at Nyonyi Gardens. So adolescents are people aged 10 to 19 years, and they are in a transition. And even before we discuss who is an adolescent, we need to understand who is a child. And a child is somebody aged below 19 years. And an adolescent is 10 to 19 years. There are various things that happen during adolescence, and these include just merely growing up, getting a growth spurt, having your secondary sexual characteristics, and making sure, and also seeing that there are changes in mood because of the hormones. So Uganda is a young country. Uganda has a population of about 45 to 48 million, depending on who you ask. But we know that 70% of our population is less than 30 years. And adolescents are approximately maybe like between 24 million and below, so which is a high population. So if we don't take care of these adolescents, they may fall through the cracks of our healthcare system. As a pediatrician, I know that my work is to ensure that children grow up, that they are healthy as they are growing up. But then when they reach their second decade of life, people forget about them. And so adolescents suffer from not just being taken care of, they also suffer because they don't understand what's going on with them. They may have mental challenges. Some of them become experimental with sex and they get sexually transmitted infections. They are going through a growth spurt where they are demanded of to excel in school. And so it could be complicated. We could go on and on and on, but I'd let you ask your questions.
Okay, so you've talked about being experimental with sex. I want us to dig into that because I have seen that I think parents have been trying, but I don't know if they're trying the right way. Like a parent tells a child, if you get pregnant, I'll chase you away from home. Are there certain parenting skills that can help us prevent this experimental sex and maybe be closer to the children? What is causing it and how can we help?
And I think that the conversation on sex and sexuality needs to start from home. When I was growing up, the word sex was like bad manners. Don't talk about it. In Uganda, it's mpisa ambi. Don't say it. But we do know that all of us, unless you were born out of an act of miraculous, birth, we were born out of an act of sex. And so the sooner we become more comfortable with saying the word sex, but also teaching our children that sex should happen at the right time, the better for all of us. That parents should learn to normalize talking about sex and sexuality with their children, of course, in an age-appropriate manner, but also ensuring that the children delay to have sex, that they should go through the life cycle of schooling and have sex when it is the right time. But for those who may not, there should be preventative measures to prevent them from having untoward consequences. And those untoward consequences include having unwanted pregnancies, also getting sexually transmitted infections to the extent that when they are older, they may not even have children of their own. Sadly, in this country, in Uganda, 1 out of every 4 girls is pregnant before the age of 18. What does that tell us? It obviously tells us that we are not doing something correctly. If a parent has a child who becomes pregnant and then you send them away, who are you sending them to? This is your child. And so it is better to maintain love, support, care. And this is what we do in the adolescent clinic. We create cohesion and connectedness between parents and their children, parents and their adolescents, so that parents are able to even have a conversation about menstrual periods or wet dreams for the boys, or even having a conversation on who are your friends. It starts like that. Parents, we need to be friends to our children so that when they start having those complicated conversations of I'm having a date and what, things are not that difficult.
So, at what age would you advise a parent out there to start these sexual talks with the children? At what age is advisable for them to start such talks?
We normally have like a cutoff period. You're 10, you're now an adolescent. Talk about growing up. But that conversation should have started long time ago. You know, when a baby asks, Mommy, where did I come from? 3-year-olds, Mommy, where did I come from? And then parents are like, mumbling and not
bought in the supermarket.
bought in the supermarket, or you are brought by a bird, a fairy, miraculous birth. The child will get confused. It's important for this child to know that they came out of their mother's womb. And as they grow older, the conversation starts to change. Thankfully, in P5, when children are about the age of 9, 10, they're talking to them about reproduction. And I'll give you a story about my own son. When he came home, he was like 9, and he came and said, Daddy, I learned a new word. And his dad is always on the edge, like, what did you learn? He said, Daddy, I learned the word coitus. And he was like, what? Coitus? What? Who told you that word? And then he went on to say that, yeah, the teacher told us that when cows are mating, they go through coitus, and then they that's the time to dig in and start the conversation. Don't let it pass. And then we were comfortable to tell him, oh, Timothy, yeah, those cows have grown, and for you, coitus is not the story. When you grow up, it will happen, and then, babies. And as the children grow, girls are getting breasts, boys are getting beards, their voices are breaking. They will probably start relating to the opposite sex. So it is preventive arrest in inverted commas, but also prevention is better than cure. If you talk to your child and tell them, look, you're now a big girl, you could become pregnant if you slept with somebody, you're now a big boy, your beard has grown, I can see your muscles are bigger, don't start relating with a girl that way because you could get her pregnant. And then the laws of the land are clear. The laws of the land state, if you have carnal knowledge with each other, whether you're below 18 or whatever, you're committing defilement on each other. I tell the adolescents that don't be in the situation where you're arrested for defilement. But then we know that young girls end up sleeping with older men. That is also a criminal offense. So everyone should be raising these adolescents and making sure that it's not only the parents, it's not only the job of the teachers, it's the job of all of us. It takes a village to raise a child, and we need to bring up the children of Uganda in a safe environment. Yes. Safe meaning they are protected from having sexual relations when they are still children. Honestly, Joy, if you see the children who are giving birth to other children in Kawempe Hospital, it pains your heart. They are at risk of getting complicated labor. They are at risk of getting babies who are preterm, and those babies are also at risk of dying and also at risk of getting complications. So many things, but together with these conversations, I believe we are going to make a big impact and ensure that our children are protected.
Yes. Thank you so much. To our viewers, I hope you're listening. And to the parents, please let's try to talk to our children about these things, as Dr. Sabrina said, when they're still young, so that as they go, we try to prevent the things that we don't want to happen to them in that regard. So another thing that I've noticed about teenagers personally, or adolescents, is they're very secretive, or like they keep secrets. They don't want you to touch their phone. They're not talking to their parents. They're locking themselves up in bedrooms. They're acting up. So do you think as parents, is that the fault of the teenager? Is that the fault of the parent?
So, thank you. And indeed, it is normal for teenagers to have what we call blues. The blues mean what? That they reach a point and they are depressed. Remember, for the first time in their life, the hormone called estrogen and progesterone and testosterone is pouring into their brain. It's pouring into their entire body. So it's important for us to appreciate that they are growing up. It's not the end of the world. But also we know that adolescents are very sensitive. If they are bullied at school, if they are shouted at, if they don't achieve their educational aspirations, they may be sad. And when they keep quiet, don't allow them to keep quiet, because depression can actually be setting in. And depression is a mental health condition that should be treated. If you look at your child and they've locked themselves in the room, day 1, day 2, the whole holiday, what are you doing as a parent? Find out. Because the next time you know, this child would have cut themselves or even hung themselves on a rope. So let us be sure that we keep the conversation going and not yelling at the child. It should be done out of love. If, for example, today my child won't wake up to have breakfast with me, I should find out. We've reached a level where, we need to reverse the way we were parented. When we were parented, it was commando style. You either do it or chiboko. Chiboko is not going to work. The more you beat a child, the more you lose their self-esteem, the more they are going to be like, you know what? I've resigned. If you think you're going to chiboko me into growing up, let me resign and I won't talk to you. But let us continue having this conversation. And I think that parents need to have an open door policy. Leave the doors open and keep the hugs coming.
But if we leave that doors open, aren't you invading my privacy as a parent?
No. I'm not saying like a physical door, like your bedroom door, leave it open.
Okay.
But the door to have a conversation.
Yeah.
If you come and talk to your child today and the child is saying, Mommy, I'm not in a mood. I'm not going with you to the market. Tomorrow, try again or find out what is going on. And we have adolescent clinics. We have adolescent counselors. We have adolescent psychiatrists. We have pediatricians who have specialized in adolescent health. Let us have a conversation. Remove the friction. I know adolescents who have not spoken to their parents for months. And it's hurting them. It's hurting the parents. Everyone at home is sad. They don't know what else is going to happen. But when you reconcile them, when you make sure that they are talking to each other, the problem is so small. My dad snooped into my phone. He saw my secrets. My mom snooped into my phone. She saw a picture of my boyfriend. Is it the end of the world? No. So can we keep moving on? We need to teach adolescents to pray. You know how we say that a family that prays together stays together? How about the families create a situation where they are all praying together? For the Christians, pray, reading the Bible together. For the Muslims, reading the Quran or saying the 5 prayers. For the Hindus, it doesn't matter. But let the families know that something should unite them. It could be eating on the same dinner table. It could be praying together. It could be playing together a game of football or a game of netball or taking a walk together.
Do you think some of these challenges that we have talked about, do you think they could be genetic? Do you think some of these things are spread from the parents genetically?
So genetics is a really huge topic, maybe for another day. But the genes are passed on from one child to another, rather from one parent to another, and they are generational. That's why they are called genes. So genes are the smallest component of humanity. And those genes sit on chromosomes, and those chromosomes are a part of our DNA, and they make us as humans. The way you look, the way you speak has something to do with both your parents
Yeah.
and their parents and your grandparents and your great-grandparents. You could trace it back and back and back and back. However, what I'd like us to talk about right now and really quickly is something called epigenetics. That if a mom is stressed when she's pregnant with this baby, if a mom is stressed as she's giving birth to this baby, the baby could also acquire the stress gene. If a mom takes alcohol when she's pregnant, the baby could acquire the alcohol intake gene. So we need to be careful. And those genes can be passed on transgenerationally for 3 generations. So when we talk about do not hit your child, fathers, do not beat your wife when she's pregnant. Cuddle her, support her, give her a good massage, talk to the baby when the baby is in utero. We are serious about it. Yeah, also massaging the abdomen.
And the mama
it's
is
so
pregnant,
important. Yeah, and that just baby listening to daddy. That my big prayer is that children should be brought up by both their parents. Of course, there are situations where this cannot happen, but for sure, God created us in such a way that we should have a mom and a dad, and if daddy is not available, have a father figure. Because women, we have a lot of estrogen, we have a lot of testosterone, we are calm, we are naturals. We don't bring that macho thing of, hey, be tough, be strong, and which daddies bring. There are studies that have shown that just hearing the voice of a father in the house is going to impact how that child will grow. Just seeing that a father goes to church, 96% of the chance is that those children will grow up and also go to church. But if it's only the mother that goes to church, maybe 33% of the chance that the children will also follow. So fathers, it's not a joke. Fathers are the head of the house. Fathers must lead, and then the mothers support. Much as we are saying today, yeah, it's a companionship, it's a what, but we need families to be real families and support each other.
So as we almost come to the end, could you give our parents out there some advice on children and also majorly adolescents, like what can they do to improve the health of their children, not just like this health of diseases and what, but also like the mental health to bring up a very holistic child and everything. Yeah.
Awesome. And as we talk about health, we need to define health. It's lack of infirmity of disease or any disease process. And it's now that we need to understand that physical health is not the only health. It is emotional health, it is mental health, it is even sexual health. And what do we talk about when we talk mental health? It means that a person is confident, they had a good sleep, they are happy, they are smiling, they're able to smile. People who are not able to smile may be having a real serious problem. And if this goes on for a very long time, maybe we start thinking they are depressed.
Yeah.
So parents need to watch out for these things. But also parents should be responsible and get their children vaccinated for the things that they vaccinated them before they were 1 year of age, but also during adolescence, we repeat the vaccinations for tetanus, for diphtheria. We also give human papillomavirus vaccine, ensure that these teens are not getting tuberculosis, ensuring that they are in a safe environment, but also that they are preventing non-communicable diseases. For malaria, yes, we know buy a mosquito net, ensure that if the child gets a fever, and by the way, malaria in adolescents is very serious. It causes kidney injury, it can give you cerebral malaria, so we need to be serious about making a quick diagnosis. But then there are other diseases like mental illness, and mental illness can start during adolescence. We know about bipolar disorder, we know about schizophrenia. It starts during adolescence. Some epilepsy disorders can also start during adolescence. Last week, I made a diagnosis of a 10-year-old who sadly started getting seizures. She was a perfectly healthy child, but at 4 a.m. every night, she would get a convulsion. And she was living with somebody who cared. Somebody who cared about her. So this person would go check on her and would find her convulsing. So put her in the same room as her, and this child continued to convulse. Imagine if this child was staying with somebody who does not care. Today we've put her on treatment. She's progressing well with her treatment, and we are going to have a good outcome. Connectedness is so critical. And connectedness doesn't mean holding hands all the time with your child, but connecting through conversation, connecting through communication. How about now during the holidays? Find out where your child is. I liked how you said that your mom always wants to know where you are and you're together on live feed. That's connectedness. But if the parents are like, I don't care where this person is, the child is going to presume that my parent is suffering from TB. Not tuberculosis, but too busy.
Oh.
And too busy hurts children. Because you're not prioritizing them. Children want to be prioritized. And then putting it all together, ensuring that the child is the priority. Parents, we brought up these children in this life because we loved them. Let us continue to love them. Let us see our children not only surviving, but thriving and then transforming their society. Parents want to leave a legacy. I know where my parents are. May their souls rest in peace. I know they are smiling at me every time they see and say, oh, our girl Sabrina, she made an impact. I feel proud that I am making my parents proud. And that's a legacy. That parents should think deeply about what am I bringing into the world and what is my child going to do to change the world.
Thank you so much. Lastly, yeah. Now, you talked about this child 4 a.m. having a seizure at 4 a.m. and what. So there's something I've been reading about called telemedicine, where doctors can easily connect with patients through digital devices, an app, telephone services and what. And that's something that has not been embraced yet in our country very well. It's there, but it's low-key. So do you think that could be a game changer in our country? Because you never know, this lady could panic and want to talk to someone, but they have no access. So do you think telemedicine could be a game changer in health and specifically child health?
For sure, yes. And as we embrace digital technology and digital health, we need to talk about telemedicine. And I like the way you said it's low-key. I know there are some people who have done so well, like Rocket Health. I really respect what they are doing. That you can pick up the phone and communicate and you get an answer. And we need to appreciate such good practices. However, we've also known that we can be bombarded by parents. Like, personally, on your WhatsApp, before the parent even picks up a phone and calls you, they are sending you pictures of the child's poop. They're sending you pictures of, I don't know what, the rash, the this, the that. And if it's not something that is really critical, I would say, yeah, go to the nearest doctor and then we can have a conversation. This is the treatment I would want to give if you moved. Because honestly, you can't be seeing all the patients in Uganda. So telemedicine is important. And we have few pediatricians. We're about 700 pediatricians, which means that one pediatrician could technically be taking care of 3 million children, which is hard. And so we need telemedicine. We need to learn how to converse. We need to open our spaces and have a digital platform where we can quickly tell us the diagnosis. Of course, parents out there think that they are Google doctors. Reading, they read about a disease, and in 5 minutes they think they've made a diagnosis. Let me remind you guys, you cannot become a doctor in 5 minutes. It takes 18 years minimal to train a doctor. And by the time a person becomes a doctor, they know differential diagnosis, they know the correct treatment, and they can make the correct diagnosis and treatment. Misdiagnosis is a problem. If you make a misdiagnosis, you're going down a rabbit hole that could end up killing the patient. And we don't want the patients to die. So something that looks like measles could be so many other things under the line. It could be German measles, it could be varicella zoster, it could be a drug reaction, it could be whatever. Okay? So please don't turn yourselves into Google doctors. And not every fever requires an antibiotic. That's the other thing. That if a child has a fever, this must be a bacterial infection, and so they start the patient on antibiotics. We have to be careful. So telemedicine will certainly be of value, and it will help us to reduce on the congestion in the hospital. I know that today many platforms are coming up, including EMRs, like electronic medical records, where we can see the patient electronically and make a prescription, and then the medicine is sent to them. And that became even more popular when during COVID, people couldn't move. So yeah, we need to embrace it and embrace it properly. By building systems and building standard operating procedures, we will protect the population. It is our responsibility not to wrongly prescribe.
Okay, thank you so much, Dr. Sabrina. On behalf of the My Doctor community, we want to thank you so much for taking off time to come and talk to us about adolescents. I feel like I've learned a lot in these few minutes. I feel like I am ready to help any adolescent around me in any way. So we want to thank you so much. So we have come to the end of this podcast. So I'd want you to give any closing remarks. Tell us about your ABCDs.
Wow. Oh, yeah. Thank you very much again, Joy. So my ABCDs are nothing to do with abstinence. Just because I'm a doctor, I believe people will be thinking, that's what she's going to say. No. Every person has to have a personal first aid kit. And my personal first aid kit since 2017 is A, ask for what you want, B, be who you say you are, C, care about others, and D, dare to live your dream. We all have dreams, and those dreams should turn into reality. Make a difference in whatever you do, but be of value.
Okay, so to our lovely viewers, hope you've enjoyed the episode like I have. Hope you've learned a lot about adolescent health and child health in general. And I'm so thankful to Dr. Sabrina who's made time to come and talk to us. So hope you've learned a lot. And we're going to be having more doctors coming on board to teach us about various things. So tune in every week. We'll be having these episodes on the My Doctor platform and on all the platforms of our other partners. Thank you so much. My name is Mwesigwa Joy. Stay with us.
My Doctor, your health anytime, anywhere.